joining us, Dr. Cara Marlatt, who is one of the lead researchers on this. And Dr. Marlatt, this seems to be something we're seeing a little bit more of, taking a medication that's already in use and studying it for its effect in another area and finding that it may be useful for both. What has this study shown you so far?
Well, thank you for having me on the show. And, we're actually just starting this study. We just started enrolling over the last couple of weeks and have enrolled a couple of subjects and are hoping to enroll more over the next coming weeks.
Is it normal for women to, run at risk of diabetes or gain a lot of weight when they finish menopause?
Weight gain can vary from woman to woman, and it's actually fairly common. Typically, the risk of diabetes or insulin sensitivity goes up after menopause. And so as women age, there is less estrogen being produced, which can lead to hot flashes, night sweats, and in some women, weight gain, kind of just to name a few. And interestingly, estrogen actually influences the way your cells respond to insulin. So when a woman's estrogen levels begin to drop during or after menopause, there's that increased risk for diabetes and poor metabolic health. So a lot of the times weight gain can vary, but many women find themselves gaining weight after menopause in the form of increased fat.
Dr. Marlatt, how did the researchers at Pennington and wherever else that they are working on this study come to say, hey, this particular drug, which has been prescribed for symptoms of menopause, might be beneficial? Was there just some coincidental information that you all received and said we need to look at this? How did we get to this point where we're actually studying it?
We actually partner with a physician, Dr. Frank Malvajavi, from Tulane University in New Orleans. And he actually found in some preliminary studies that this might be a beneficial effect of taking the treatment. So we might see an improvement in insulin sensitivity. And he saw this in some animal models, and so now we're trying to test and see whether this already approved drug might do the same thing in people.
What do you tell women who are gaining weight after menopause, and do you have any tips that might help them to stave that off?
It's fairly subjective from person to person. Males and females both go through very different hormonal changes in response to aging. And while we always recommend, regular exercise, kind of a healthy diet, better sleep, it's always good to consult with your physician or your OBGYN for your specific needs.
Dr. Marlatt, if a woman who is in menopause now or perhaps has completed menopause would like to participate in this study, is there still room? You said that it's early in the study, and I'm thinking there are probably people listening right now that said I would be willing to give that a try. Is there still room in the study?
Yes, absolutely, and we'd love to have anyone that would be interested in possibly coming in to check us out or just giving us a call. We have a bunch of people who are willing to give you more information, and myself personally. But essentially, we're looking for women between the ages of 50 and 60 who have gone through menopause in the last few years. And so participants will receive a lot of great health information for themselves and to kind of share with their doctors. And so they'll also be compensated for their time as well. So if anyone is interested in participating, I can give you information about how they can get involvolved.
Well, let's hear that right now. Go ahead and give them the number.
Perfect. And so to find out more about the Rouge study, which wasn't initially described, but it's actually called Rouge, is Raising Insulin Sensitivity Post-Menopause. And to participate in that study, you can go to www.pbrc.edu/healthierla or by calling Pennington Biomedical at 763-3000.
Okay. We appreciate your time. Our guest has been Dr. Cara Marlatt. She is a researcher at Pennington Biomedical, looking at ways to help prevent diabetes in postmenopausal women. And if you'd like more information, we will put that URL up on the activity stream.
Very good. Dr. Marlatt, appreciate you being with us this morning.
I appreciate you having me. Thank you very much.